Thank you again for giving up part of this warm, sunny, beautiful day. But I know it's going to be well worth it. This is the first of our community speakers, and it is being taped, so if you have friends who don't make it and you say, oh, you missed the best one, it'll be up in a few days. It has to be processed before it gets put up on Blackboard. Did anyone not get a pamphlet? Three over here, yes. So I want to start by introducing Cindy Price. Cindy has agreed to come and talk about her living with a vestibular disorder. As you can see from this very nicely done pamphlet, there is actually an association related to it. And Cynthia Ryan, who is here, is the executive director. So if you have questions afterward, there'll be time for questions. But if you have more questions and you want to have a more one-on-one conversation, they probably have a few minutes afterwards to talk, and you've got two different people to talk to. And with that, I'll let you go.
All right, thanks. So my name is Cindy Price, and I have not only one or two, but I've had at least 4 vestibular disorders. So unfortunately, you're going to kind of get the chronological story because that's the only way I can make sense of it. So just to let you know a little bit about myself, I am married, have been for a little over 10 years, no children. I feel fortunate now that I don't have children because I could not have been a mother to them for the last 6 to 12 years, depending on how you look at my illness. We do, however, have 4 pets, so my husband gets to take care of them when I'm not doing well. I work at Regents Blue Cross Blue Shield of Oregon in communications. I've been there a little over a year, and I just moved from Kansas last February. Best decision I ever made, not just because I moved from Kansas, but particularly because I moved to Portland, not realizing how many years I'd been looking at the Vestibular Disorders Association website for information, all of the great doctors here, just an amazing crew of professionals who've gotten me to the right place. So I'm on my way to, I hope, ending my suffering. And actually, in 48 hours, I will be recovering from a surgery for a paralimb fistula. So I'll tell you a little bit about what that is, tell you a little bit about the surgeries I had last year, and then I'll sort of get into what it's like to have a vestibular disorder, and then onward to sort of the history of what my experience has been. So the surgery I'm having on Wednesday, a paralimb fistula happens at either the round window or the oval window inside your ear, very tiny, like size of a pinprick. There's no way to confirm it through testing until the doctor is actually in there and ready to do the surgery. So even as late as last week, my doctor and I were talking about, could it be this, could it be something else? It sure looks like it's a paralimb fistula. What will happen in the surgery is they will make a flap at my eardrum, move that aside, take fascia from behind my ear, put it in a mixture of enzymes that makes it sort of a glue, put that over those 2 holes, fill it up with gel foam, and then seal me back up with a ventilation tube in my eardrum. So I'll be mostly deaf in that ear for a while. Right now I don't have any major hearing problems, so I anticipate that my hearing will fully recover. But the really annoying part of it is that it involves 3 weeks of bed rest, followed by another 5 weeks of restrictions like bending over. I won't be able to bend over for 2 months, which doesn't sound that bad until you think about, gosh, I'd like to walk the dogs, but I can't pick up the poop, so I guess I'm not walking the dogs. So that's what's happening to me in 2 days, and it is exciting in that I think this is going to take care of it, and I can go back to living a normal life. the surgeries I had last year. And Cynthia, if you'd go ahead and pass this around. I had surgeries last year on each ear for superior canal dehiscence. What that image is showing you on the left-hand side is an enhanced CT scan, and not many CT scans can even zoom in this close, but the gap that you're looking at between, at the top there should be bone, and there isn't. That's about 1.5 millimeters. I think that's also about the size of your pen or pencil lead. Very, very tiny hole. That's a hole in my temporal bone. It's right above the superior canal in my ear, so instead of sound going in the round window and out the oval window, or whichever it is, it's one of the two, it's supposed to go in and out. But that when you've got this third hole, then everything becomes amplified. So my life was, it was like having a constant migraine, or a near constant migraine. So on April 15th last year, I got the diagnosis that I had bilateral superior canal dehiscences. I couldn't tell you how rare they are. I just know that they're considered a rare disease. On autopsy, about 1 to 2% of people have a thinning of the bone, but I don't know how rare it is that there's actually a hole in the bone. So yeah, my other neurologists and audiologists didn't catch that. And I can understand why now. And actually, superior canal dehiscence was not discovered until 1998. So I feel very fortunate to live in the time that I live in, because had this, had I been born 20 years earlier, who knows, it would have been 20 more years of suffering. So those are sort of the big surgery things that have happened in my life lately. Some things that made diagnosis really difficult. I've always considered myself to have poor balance. And there are just some things that you're good at and some things you're not good at. Like, I could ride a horse fine, but doing a cartwheel was like a Hail Mary. I have no idea what's gonna happen. Am I gonna complete this cartwheel? Am I gonna fall on the ground? Your grade school skating party, I would get to where I could skate okay, and then someone would pass me and I'd fall down. And I just thought, I have bad balance. And maybe that was it, or maybe it was that I had these dehiscences that were just, so slight at the time that they weren't really that much of an issue. But I will say that one of my earliest memories is having a migraine. And migraines have been very closely related to my vestibular systems, and that isn't the case with everyone. A lot of people will mention that they might get the occasional migraine when their symptoms are at their worst, or they might have the occasional tinnitus ringing in your ears. And I've had ringing in my ears since I was a teenager, but I went to a lot of concerts and I stood at the front and I called it concert ear, and it just never went away, one day. So I chalked it up to that, and I had allergies. And started doing allergy testing in middle school and had a lot of headaches, and the doctor said, oh, it's a sinus headache. Oh, we'll get you on medication. Finally, in 2002, I had sinus surgery, and it wasn't just my sinuses. I have a lot of pain in my jaw. I have TMJ. I now wear an appliance for it at night. And the doctor, the dentist at the time said, oh, TMJ is your problem. This $2,000 appliance, that's gonna fix everything. Your headaches are gonna go away. And they didn't. I have a rapid pulse. It isn't quite tachycardia. I think you have to be at like 100 beats a minute. But since I was a kid, my heart rate has always been around 90 beats a minute. No matter whether I was in shape or not in shape. I just always had a rapid pulse. So these were things that sort of threw the doctors for a loop. And then as I started going to more doctors to try to figure out what was wrong with me, we sort of added to that confusion. From after doing a sleep study, they said, oh, well, you have sleep apnea. Let's test you for sleep apnea. And I said, I don't. I sleep fine. I am still tired when I wake up, but I insisted that my snoring was mild because my husband insisted that it was mild. And so we did the sleep study. Oh, you have periodic limb movement disorder, which is essentially restless legs, but when you're sleeping. And then the neurologist sent me to a pain specialist because I complained about all the pain in my body, and we did nerve conduction studies, which I don't know if you know about nerve conduction studies, but it hurts a lot less when you don't have nerve damage or when you do have nerve damage. So, it didn't hurt when they did a study on my right arm and found out that there was some nerve damage there. But that's probably from using the mouse weird and sitting weird because I have a hard time sitting up straight. So I went to this pain management specialist after the pain patches. I can't think what they're called, but it's basically like an NSAID in a patch that you put on your body in a problem area. And those didn't help. So the pain management specialist did trigger point injections, which is essentially taking that knot in your muscle and injecting, maybe it's lidocaine and something else, and it's unimaginable. I mean, how much pain you are in when they do that. But again, I was carrying my body weird. I still do, but to a lesser degree. But all of those things cause those knots in your muscles. So when I saw that pain management specialist, he said, you need to go see someone about fibromyalgia, because he asked, where do you hurt? And I'm like, I hurt everywhere, and I'm in tears. This is before the shots. I was already crying. And so then I started reading about fibromyalgia, and it was like me to a T almost. So I went to a rheumatologist. So, okay, could this be the problem? Could it be if we take care of the fibro, and I can get to where I can manage that, does that make the headaches get better? And so that was a route I was pursuing for a while. And yes, after hours and hours and many blood tests, etc., he said, yes, you have fibromyalgia. And, to this day, I fit the diagnostic criteria. I don't think I have fibromyalgia anymore. Or I guess I should say, I don't think it's idiopathic. I think it has a cause, and I think it's my vestibular system. So continuing to pile on diagnoses, I found out I have a hole in my heart. Well, like 25% of people have a hole in their heart. They just don't know it. And so mine is relatively mild, not large enough to require surgery. It could contribute to my headaches. But so just sort of an overview of my my symptoms. The reason I started to notice that I had vestibular problems was really a combination of migraine and vertigo. So I would hear a loud sound, and it would set me off. I felt like I wanted to fall. I couldn't sense where I was in time and space, I had such terrible pain on my head. Sometimes it was unilateral throbbing, like a traditional migraine, but more oftentimes it was like a tension headache that was so extreme. It's just like having your head in a vice grip. And so I was extremely sensitive to sound triggers. Driving was awful. Going to a movie was impossible. Going to a restaurant, terrible. And so those have sort of been my two big battles, have been vertigo and migraine. But so there's a date that I consider when I got sick. And it isn't really when I got sick, but it's sort of when my life completely changed. And since that date, that's when I noticed that I had a headache all the time. Like, I knew I used to have headaches a lot, but occasionally your headache gets bad enough and you pop some ibuprofen and you're fine and you go on your day. So at this point, when I got sick in February 2008, I know that I've had a headache every day since then. And I know that I wake up with it and I go to bed with it. And most of the time it's like a 2, sometimes a 3 on a scale of 1 to 10. And then when it gets to about an 8, it's like, okay, let's talk about going to the emergency room. and then, by your second trip to the emergency room for it, it's, they're looking at you like you're a drug seeker. So again, probably not representative of most people with vestibular disorders, but for me, this is what it ultimately led to because my body was just on such high alert. So I mentioned the sound sensitivity. Typical before my first dehiscence surgery, everything I heard was like 3 times the volume you hear it at. Everything was loud. So if there was a light buzzing in the back of the room, I would be able to hear it. And I would just zone in on it because I couldn't take in anything else. It was so overwhelming. It's sort of, that sensory overload is sort of like autism in a way. It's very easy to be overwhelmed by sight or sound or not being able to understand maybe what someone is saying or not being able to communicate back to them. Even though I'm a lot better than I was a year ago, I still have times when I can't speak. And what did I say to my husband the other day? He was trying to have a conversation with me, and I think I just said, "Don't want to talk." I left, because that's like all I could get out. As part of that sound sensitivity and light sensitivity and motion sensitivity, there's a tremendous amount of brain fog that comes with it. It's not like, oh, I walked into this room and I was going to do something. What was I going to do? I forgot. It's more like you stare at a page and you can't comprehend a sentence, and you reread that sentence and you still can't comprehend it. It makes working and being employed very difficult. When I first got sick, I had a job where I was doing graphic design, and I had to compare this Excel chart on paper to what I had on my screen, and just looking back and forth would trigger it, and I'd have to take a break for an hour or more. I was very, very sensitive to triggers early on. So I mentioned the tinnitus that I've had ringing in my ears for about 20 years. So there's a standard constant pitch. It's now just in my left ear. Since the first dehiscence surgery in my right ear, I think I don't have tinnitus anymore in that ear. I think it's gone. It's so loud in my left ear now, I can't really tell. I can hear it now. And then sometimes I have pulsatile tinnitus, so I hear my heartbeat in my ear. And that was kind of one of the cues before I had my first dehiscence surgery, that it might be a dehiscence, because when I would just walk upstairs and that would make me dizzy, but then my heartbeat would be so loud in my right ear that it was just overwhelming. Some people with superior canal dehiscence hear their stomach. I know most people hear their stomach sometimes, but I used to hear it a lot. Some people hear their eyeballs move, and I consider myself incredibly lucky that I've never heard my eyeballs move. And then I have a couple of other hearing issues. I test perfectly on a hearing test. I used to hear flapping noises though in my ears, and it was like swimmer's ear, if you've ever had swimmer's ear. So I don't know how many times I went to like Walgreens and bought over the counter swimmer's ear stuff, and you treat it for a few days, and I'm like, well, flapping stopped. Okay, I must have taken care of it. But that's not what it was. It was just another part of the hearing component of this. And then also sometimes I go temporarily deaf in one ear. I had it happen yesterday in my right ear. It hadn't happened for probably a month or two. It's very short-lived, and my hearing sort of slowly comes back. All of these things I thought were normal, and then once I got sick in 2008, I started to ask my husband, hey, does it hurt when you do this? Hey, does this make you dizzy? So he's my control group, and thankfully he's very healthy. And he's been quite reliable, so that kind of helps me too when I go to doctor's appointments to say, hey, this weird thing is happening. So I know most people would start off right away with dizziness probably when they talk about their vestibular problems. At this point, I'm dizzy all the time. I always have that lightheaded feeling that you might get, like, if you held your breath for a while and then stood up quickly and you had that drop in blood pressure or whatever. But that's pretty constant now. The vertigo only comes, I shouldn't say only, 75–85% of the time, it's with movement. My daily commute is to drive 2 miles, take the Max downtown for about 40 minutes, and then walk anywhere from 5 to 10 blocks. So while I'm driving, that dizziness and vertigo make me feel detached. I feel like I'm not sitting in my car. It's very easy for me to lose concentration and just, instead of snapping back and realizing, oh, I'm on the road and I'm driving, I just sort of drift back and go, crap, pay attention to the car in front of you. So that's one of my tricks. I like to be behind a car. I don't like to have a car behind me, or I like to have a car kind of sort of in front of me, beside me, so I can pay attention to what they're doing. And it helps with stoplights too. If they're stopping, I should stop. It's very hard to make sense of what's going on with traffic signals and looking both ways. And even walking to the train at night, 10 blocks, and checking each time I get to a street is exhausting. And I've been almost, well, there was one time I almost got hit by a car. There have been a few times I've almost been hit by cyclists because I'm not trained to look for them. I'm trained to, they're not going to kill me. The cars might, but the cyclists, it would just be bad for both of us. So you start to prioritize, how dangerous is this? Do I really need to go out and go shopping? No, I don't remember the last time I went to a grocery store. My husband does it. I just don't go to any stores at all because there are so many places to look. And the grocery store is especially bad because, the aisle might appear wide, but when I look over here at this cereal and then I'm looking over here at this granola bar and I keep looking back and forth, if I would just walk through maybe and look at one direction and come back on the other side, maybe it would help, but I'm not that patient. So as I already mentioned, once you combine all of these things, it's incredibly hard to stay upright. It's hard to keep walking straight, and it wears on your body. So for me, it's very much been a muscular problem. I've done so many rounds of physical therapy. I don't even know. I don't even know. And we've tried massage, and we've tried working on trigger points, and we've tried balance-related things, and I wasn't getting anywhere because I had holes in my head that needed to be closed before I could start to improve. So I hope that sort of gives you an idea of what the symptoms are like, and I'll talk a little more about them as we go on. But I mentioned how hard it is to drive, and being on the train, every time the train stops, I feel like I'm still going. So it might be 3 seconds or it might be like 15 seconds. So when it's time for me to get off the train, I have to be ready, I have to be holding on to something, I have to hold on to something until I get off the train. I've had people ask me to move so that they could get up for their stop, and I have to tell them, I have bad balance, I'll get up as soon as it stops. And they've always been very understanding. But then there are those days when I have to stand on the train for 40 minutes and get jostled around, and I'm wiped out for 2 days after that. But how do you say to someone, I know you think I might look healthy, but I really need that seat. Could you please let me have that seat? I don't have it in me to do that. I don't know if that's pride or stupidity or both. And by the way, if you guys have questions as I go along, please feel free to shout them out. I might lose track of where I am, but help me get back on track. So once, let's say I get to work and I've made it successfully, and my nausea has been limited. At work, the lights aren't right. Even though I have a lot of natural light, there are enough fluorescent lights that it's still too bright. Before the dehiscence surgery, I would have worn sunglasses a lot. Now they're just bright lights that are uncomfortable. There's a water pipe that's like 12 feet from my desk. And the minute it kicks on, I put on noise-canceling headphones. I don't even have to plug it into anything. I just need to block out as much as I can. When I'm on a meeting conference call, if I'm just listening, I can usually just have my headset on. But if I have to actually speak, I put the noise canceling headphones over that so that I can at least limit how much of what I'm hearing, what's going on around me. And it's not like my coworkers are loud, and I don't feel like I can say to them, hey, your voice really, really bothers me. It's not personal, but so work is very difficult, and on a good night, I sleep about 9 hours. This weekend, one day I slept 12 hours. I felt pretty good after that. But again, it goes back to my body just being so fatigued, so exhausted. So I need at least 8 hours. And when my symptoms start to get bad, I usually get very sleepy. And I can sleep about anywhere. I once fell asleep in my car, and it was like 90 degrees out, and I didn't even mean to fall asleep in my car, and probably an hour passed. It was supposed to be my lunch hour. And so here I am, I wake up and I'm sweating in my car in this parking lot, and I realized, oh my God, I need to get back to work. But I felt a lot better after that. But it's kind of dangerous. It just is, it overcomes me sometimes. So I like to say that my superpower is my ability to sleep, but I'm kind of hoping that will wane some as well. So I mentioned stairs. I used to have pulsatile tinnitus in my right ear when I would walk upstairs. Now I have it in my left ear, completely gone from my right ear. And so I chalk that up to the dehiscence surgery. It could be it was always in my left ear, but it was so loud in my right ear that I just couldn't tell. It's kind of like when you hear a noise that's more or less in front of you, it's hard to tell if it's more on the right side or more on the left. But so my home has thankfully just one set of stairs. But while I'm recovering from my perilymph fistula surgery, I cannot use stairs. So I will be living in the 400 square feet that comprises my living room, dining room, bathroom, and kitchen downstairs, and not able to go upstairs where our bedroom is. I was told that I could make the decision to go upstairs and stay upstairs for 3 weeks, but that was a little too claustrophobic for me. I like the idea that the doors are nearby. I like that the kitchen's nearby. I don't know. I just feel a little more independent being in that tiny space. So let's see, some other things. Not all stairs are problems. Outdoor stairs are usually okay. I can usually walk downstairs fine. But if they're enclosed staircases, it's a different problem. It's like staircase by staircase. So, how do you explain to your employer, no, I'm sorry, I can't do that because I have to walk up those stairs? It doesn't make any sense to anyone, and it doesn't make a lot of sense to me. Like, I have to see the staircase before I know if it's going to be a problem for me. At my old home, it was 2 levels plus a basement, and I went up to the second floor maybe twice a year. I went down to the basement maybe twice a year, and that's where the laundry was. So my husband's been doing laundry like for 6 years now. He's done with it. But just the simplest things like loading the dishwasher. I can load the top rack, but I can't load the bottom rack. Or if I am going to load the bottom rack, I get a bunch of plates stacked up, and I get silverware on top of it, and then I bend over once, put it all in at one time. These things that sound ridiculous. But yeah, walking our dogs is difficult. Scooping the cat box is difficult. And I've made this commitment with my husband that we're going to take care of these animals, and then it's like, and now I can't take care of the animals, so you get this responsibility. So any questions at this point before I sort of get into history and like what happened when and all that exciting stuff? Anything? Yeah.
You talked about like your self-driving. What about like sitting in a car for the people are doing that? Since it's a confined space and you're also moving and all that type of stuff, but like the noises and then also you like
it's weird. I can listen to music most of the time, which is really strange. Like even when my headache's really bad, until my headache gets to be like a 6, I can listen to music I know. And if it's music I don't know, I can't listen to it. I have to turn it off. As far as the movement goes, I'm fine with the confined space. I haven't noticed a big difference between front seat and back seat. I'm a little more comfortable in the front seat, but so when I was at my sickest, when my husband was driving, you know that moment when you realize you've gotten too close to the car in front of you and you kind of push on the brakes too hard? Like in my mind, I was going, push on the brake, push, stay back. It was way too close for me. And even though I know everything he did was perfectly safe and he's a competent driver, but I was very sensitive to it, very sensitive to potholes. In Kansas, in the city we lived in, you had a lot of streets that had deciduous trees that overhung the whole street. And so it would be this constant sprinkling of light and dark, especially in fall and winter once the leaves were gone, and it drove me batty. I would drive with my eyes just barely open because it was so much to take in. So I'm really glad that streets here are more open and there are a lot of coniferous trees instead. But yeah, even when I think I'm doing pretty good, sometimes when my husband's driving, I'm like, seriously, you need to slow down. And I get kind of snap at him, but he knows that to me it feels like things are happening a lot faster than they are. He's an awful nice guy. Does that kind of address everything? Okay. So yeah, better when he drives, but then there are sometimes I feel fine to drive, and if it's nighttime, I know that I'm a better nighttime driver. If my vestibular problems aren't that bad, but my headache is, I just pop an NSAID and drive because I know I'll be better off driving at night. So kind of how it all started. I told you guys about how I kind of had weird balance problems when I was a kid, and I had migraines early on, but they weren't frequent or anything. So I was having a lot of like frontal headaches, and went to an ear, nose, and throat doctor, and he said I needed sinus surgery. So I had polyps removed, I had some canals widened, whatever the technical term for that would be, and I had a deviated septum fixed. And immediately after surgery, first off, I noticed my voice was different. My voice still doesn't sound right to me, which was something I had hoped the dehiscence surgeries would correct. So for years, I just chalked it up to my deviated septum. I thought, okay, this is what I'm supposed to sound like. But I still kind of feel like I hear my voice in my head. And then, so the first few days are just a blur of medication. Really, the first week was. But pretty quickly, I realized I was having this tremendous pain, and it was that vice grip pain. It was throbbing on both sides, some vertigo, but I was so drugged up I didn't really know what was going on. So when I went back to see the doctor, I told him, hey, this stuff is happening, and I told him, I can't go to a restaurant because the clinking of the silverware on the plates drives me crazy. I can't take it. I will cry. And I'm not an emotional person usually. It's physical pain that's making me cry. I told him I can't go to a movie. It's too big and there's too much movement and can't drive, and people shutting a drawer at work will just set me off and I'll start crying because I'm in so much pain. And he said, you're having migraines. And it had never occurred to me. So we tried a few medications, and then over 4 or 6 months, I just sort of got better. None of the medications helped. All of them made me sick. It was 3 different classes of drugs. I remember that one was a triptan. I remember that one has been recalled from the market, and I remember that one was a 3rd class of drug. That's all I remember. So I kind of thought, okay, this is behind me. So it was 2002. 2008, I remember it was Valentine's Day. It was the first Valentine's Day that I wasn't a second shift worker. So this would be the Valentine's Day when my husband and I could go to dinner, and I don't really care about Valentine's Day, but it was still like the novelty of it, So we kind of talked about, well, should we go out? And I don't know, I just felt kind of cruddy, and there was nothing specific I could describe. But then over the next few days, my jaw sort of started to ache, and I happened to be at my dentist, and I mentioned it to him. And he said, I think think I need a root canal, or I think there's like an abscess or something in my sinuses. And he took x-rays and he said, no, you're fine. Go see your allergy doctor. So I went to my allergy doctor. This was not the guy who did sinus surgery. This was yet another doctor. And that doctor said, let's put you on some antibiotics. Didn't help. I told him I'm getting dizzier, I have more pain, I have this constant headache, you know, a lot of dizziness, a lot of vertigo. And he said, well, we can do a CT scan or you can do another round of antibiotics. And I just felt like these were both ridiculous options. You know, I thought, I've had a CT on my sinuses before, everything should be cleared out. This isn't what it felt like before sinus surgery. So, so I started looking for another doctor. And I didn't even know, like, who do you see when you're dizzy? I had no idea. So I told enough people, hey, I feel crappy, and here's how I feel crappy. And someone said, well, hey, you need to go see this doctor. And he was well known in town. After I found out about him, I realized that I'd heard of him before. He was an audiologist, and I think he liked me in part because I was kind of an enigma. So he was a great guy, but so he thought that I had vestibular neuritis, which is there are two branches of. I don't think it's your vestibular nerve. I don't know, you have one branch of the nerve that affects your hearing and one that affects your vestibular function. And so vestibular neuritis basically means that that branch of the nerve is really agitated right now. It could be something viral, it could be something idiopathic. So, you know, we talked about how I just sort of felt crappy on Valentine's Day, and maybe whatever that was just some mild virus, and this is how it ended up presenting. So, you know, by this time my headaches are getting worse. By the time I've seen him, I no longer walk like a normal person. I walk like I'm drunk. I would look at that door and I would just sway the whole way there. You know, you just keep looking at the door thinking, I'm gonna make it to that door. And I know that people looked at me, and it was incredibly awkward. And you really start to reflect on how much you care about what other people think. It was a good lesson in that. But I was so stupidly determined that I was gonna, you know, drive to work and then walk the block and a half across a really busy street. And so at this point I was like 5 months into a job. I had almost no time off. I was an hourly employee, so I was just nickel and diming every moment of time off from work to go to a doctor's appointment, to go to physical therapy, to be sick in bed. And so the treatment for vestibular neuritis, there are two main paths that people go. One is to use corticosteroids, which we did, and it helped some. He also had me use a scopolamine patch. It goes behind your ear. Awesome, amazing, best thing for me. It's also really easy for your vestibular system then to start relying on that, so you can't use it for a long period of time. You can put one patch on and it'll last 3 days. And then I'd get to the end of the 3 days and call the doctor and go, I still can't get out of bed. and so he'd say, okay, well try and go, you know, 3 or 4 days before you put the next patch on, to sort of wean me off of it. But I very much relied on that scopolamine patch. It's funny to watch like TV procedurals, you know, cop procedurals, and they're like, and that people were dosed with scopolamine, and I'm like, don't give it a bad rap. You know, I'm sure in high doses it does something different than my experience, but I have learned a lot about drugs in the last few years. As he tried to wean me off the drugs, the other route to go is vestibular therapy, and that involves things like, I mentioned how hard it was to look from my computer screen to the piece of paper. So they have you hold up playing cards and look at, you know, the heart on this card and then the diamond on this card, or you focus on some very distinct aspect of that and just look between them. Another type of vestibular therapy would be walking down a hallway and looking to your left and looking to your right and like looking at the same point. So if I were looking midway here, and as I walked, I would continue to look at those spots so that I'm moving my head further and further. the thing that people don't like about vestibular therapy is you feel really awful after a session of it. So you might go into it at least feeling mediocre that day, but it's really hard to come away feeling so bad and then tell yourself, yeah, I'm gonna go home and do that again. You know, it's really easy to just wait till the next session and sort of put it off. But again, I was not getting better because I had holes in my head that needed to be filled. One time I drove to, so one time I was going to this biometric screening that my employer was having. I go to the building, I take the elevator down. It makes me very sick, like, oh my God, I don't even want to walk in the room. But I think it was like you get a $25 gift card or something for doing this, right? So I've got this incentive to go. And so I walk into the room and there are people set up at all these stations, and it was really overwhelming. And you know, by the time I got to the end, I was crying. Again, so much pain. And here's this nurse telling me, you're obese, and I'm crying. And, you know, and just telling me, you know, your cholesterol looks okay, and this looks okay, and blah, 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 but you're fat, and I'm crying, and I'm thinking, oh my God, all these people in the room are thinking I'm crying because the nurse just told me I'm fat. And it's like, so not the case whatsoever. So right after that, like a few days later, I went to have vestibular therapy, and I was still doing really awful. And to get to the office, I had to drive through a roundabout, so that would make me sick. And then his offices involved, there was like a glass half wall that I had to walk by, so you could see down to a floor below, and that would make me sick. So by the time I got to vestibular therapy, I just cried. And I told him the story, and I'm like, you know, this was so humiliating, and it's not because of the reason everyone else in the room thought it might be humiliating. And I couldn't even do anything that day. And he, you know, he just sat there and talked to me for the hour because there was nothing I could do. I couldn't bounce on a trampoline. I couldn't bounce on a ball. I couldn't do something with my eyes closed. I was just incapacitated. I worked for the state of Kansas, and my brother did too. He was able to, through a shared leave program, I believe he gave me 80 hours of leave. I used all of it. So I was very, very, very sick for 3 or 4 months. At that time, my friends said, hey, we're going to Chicago and I bought you a ticket, come with us. And I said, yes, I think I'm better. And I never should have gone. It was the worst thing I could have done for myself. It was the worst thing I could have done for those friendships. Because the entire train ride from O'Hare to downtown, I cried at every stop. It just felt like I was falling and falling and falling. And then we get to the hotel, and we're on like the 40th floor. And so we'd get off the elevator and I'd have to hold on to the wall, and I would stand in the hallway and I would cry because that's all I could do. And so, you know, we finally got to the point where I was like, you guys seriously go out and do stuff without me because no one's having fun when I'm here. And one night we were walking back to our hotel and I was incredibly dizzy and I tripped and fell and I cracked my patella, and it took weeks to get that even looked at. So, that's the only time I'm officially fallen. I run into walls a lot and door jams, and I catch myself frequently. But I thought I was well enough, and of course I hadn't ridden on a train in Kansas, so I wouldn't know that riding on a train in Chicago was going to be a problem. I do fine with flying as far as I don't feel additional vertigo. I do sometimes, if we're on the ground, I have to look out at the tarmac to know if we're moving or not. But I've kind of gotten to the point where it's like, don't trust your body. Just, if you need to, look with your eyes, see what your eyes are telling you, and then just believe that. Don't question it, believe it. But flying I do somewhat okay with. For whatever weird reason, I can be on a boat and I'm fine. I have no idea why. As a kid, I used to love amusement rides. I never got sick. So I don't know if it's like I have some, maybe that's my other superpower. I don't know. So eventually, after, damaging some friendships and barely keeping my job and so much more fun, the audiologist said, your vertigo is mostly under control, and it seems like headaches are your primary complaint. And by this time, it absolutely was the headaches. I could not ditch this headache. And it seemed like I would experience these triggers, and then that's what would make the headache worse. And so he said, okay, well, there's this headache specialist in Kansas City, an hour away. I'm going to send you there. And so that's when I started doing like the nerve conduction studies, the sleep study. They did 2 MRIs, an MRA. I was so disappointed when I went to get the results of my MRIs, and they were like, nothing's wrong. And I'm like, I want lesions or a tumor or something. I want to know what it is and have it removed. So at this point, I'd been sick, what I call sick, for about a year. I probably had 4 appointments with that neurologist's office before I even saw him to actually prescribe me drugs. So I was desperate by this point. And I remember the neurologist who went over my MRIs and MRA with me, I remember saying to him, and I had to have someone drive me to every appointment for the first 2 years or so, because I couldn't drive an hour and a half in city traffic especially. But I remember asking that neurologist / radiologist, what can you tell about my vestibular system? Does it look okay? Because I had vestibular neuritis and nothing's been right since then. And he was dismissive all around, but he was particularly dismissive when I asked that. And I said, I want you to show me the scans. And he just acted like, I was clearly someone who'd spent too much time on the internet, didn't know what I was talking about, and I'm sure I had. But I knew that there was something to this vestibular thing, and the audiologist hadn't been able to help me, and now I was with a neurologist who wasn't addressing that yet. But so, starting late 2008, early 2009, is when I started seeing a neurologist regularly every 2 to 3 months for the headaches. And the idea was if we treat the headaches, everything else goes away. Maybe the fibromyalgia is something to be dealt with separately. Of course, I didn't have that diagnosis yet, but he knew that I had problems with muscle pain. So I think the problem is that he was looking at my symptoms as triggers. These are things that trigger the migraine. Well, or how do I want to say it? I don't even know how to say it. I think we were confusing triggers and symptoms. So when I experience so many triggers, that's when I get a terrible migraine. And then the triggers get worse as symptoms. And I went back to it, but not as firmly as I should have. I'm really disappointed in myself that at every appointment I wasn't like, okay, so I'm, my vertigo is this bad, my dizziness is this bad, my sound sensitivity is this bad, et cetera, et cetera. But my migraine log was, how much pain are you in? Well, my worst pain today was a 4. That doesn't look as bad as back when it was 8. But, my cognitive function is 50% what it should be. So there were all these things that we weren't measuring that needed to be measured. It was a lot of work. It was a lot of work keeping track of what I was taking, titrating off of drugs, titrating onto drugs, switching from an SNRI to an SSRI, switching from a beta blocker to a calcium channel blocker. I took other drugs for mood disorders. It's a really old school antidepressant.
Tricyclic.
Yeah, it was a tricyclic bupropion. No, that's Wellbutrin. Amitriptyline. So amitriptyline, I gained 40 pounds in a month. So it's really great for your body. Just from not changing anything else about my diet or my activity level, I lost 30 pounds just from stopping taking all these medications. I'm still at a point where I of course want to be healthier all around, but it's really hard when you feel like crap all the time to be like, no, I really need to eat the strawberries instead of the cookie. I don't want to fix the strawberries, I want to just buy the cookie. So and those drugs mess with your body so clearly. So in the course of 4 years, 5 years, 4 years, I tried almost 40 medications. Some of them were for epilepsy. One of them made me vomit. I was on Cymbalta, and I was titrating up to 60 milligrams. I finally got to like 30 milligrams. I could handle the nausea, and I hadn't vomited yet. And I was seeing spots, and I couldn't read anymore because the page looked red and yellow. But like those first 25 or so medications, I really held on to them like, I am not giving up. This could be the one if I can just tough out the side effects. And I went to those appointments so optimistic. This is going to be the time that he fixes me. He figures out what's wrong. And then, after about 25, it was like, just going to go see what this one does to me. How miserable does this one make me? With a couple of them, I had hallucinations, like flat out. I just saw someone get on the elevator in front of me. There's no one on the elevator. One I stuck with to the point that I was taking it at night for pain. I couldn't tolerate it during the day, and I would have to have my husband turn on the light in the middle of the night so that I knew that all the stuff I was seeing on the ceiling wasn't real. Like, I knew mentally it wasn't real, but I just needed him to turn on the light so I could see that it wasn't real. Drugs, bad. No, they're not. But for a doctor that I was seeing only every 2 or 3 months, I really felt like I have to really stick with this because I'm not going to have another chance at another one until I get, to see him again. And it wasn't like I could call him up. In some cases, I did say, I need to stop this medication, or he would tell me to. But then that was still just really a bummer because I knew I was going to have to wait till I saw him again to try something else. He started me off on propranolol. I can't remember if it's a calcium channel blocker or beta blocker. But as I mentioned, my pulse usually runs about 90. And so I was following the titration advice or guidelines. And like the next day, my pulse was down to 60. And it just kept dropping. And finally, someone from work drove me to a doctor, and they did an EKG, and it was hovering around 60, and which would be great if I were a runner. That'd be awesome. But I said, okay, so at what point do I go to the emergency room? And by this point, I'd bought a watch that would let me check my pulse. And so they said, well, when it drops below 50, go to the emergency room. I was like, okay. So, I'm toughing it out. I'm going to keep taking it. I'm going to stay at this lower titration, but I'm going to keep taking it. And I think it was that night or the next night, I just laid on the couch and I checked my pulse every once in a while. And I'd be like, say to my husband, it's 48. Do you think we should go? Well, let's wait a few more minutes and see. So, I needed a doctor who was more accessible, I think. Or maybe I shouldn't have been so stubborn. Maybe I should have given up on things a lot faster, but I just didn't want to give up. And then finally, the worst of all drugs caused violent mood swings, and I would stand at the kitchen counter, unable to speak, and just sob. I'm not a violent person. I can be a cranky person, but I'm not violent. I threw our kitchen table, over like something out of a bad Lifetime movie. I flipped the table. I was so angry about, I have no idea what. I think I was just angry at how I felt and how I couldn't communicate. It really, it really did a number on me. That was gabapentin. Actually, I had corrective eye surgery a few months ago, and they saw on my sheet that I shouldn't have gabapentin, and they were like, oh, and nothing for the pain? And I said, oh, no, 1 dose. I'll take 1 dose. Yes, that's fine, please. Whatever you're going to give me for the pain, for eye surgery, yes. but nothing sustained. So I have a nice lengthy list of medications I shouldn't be taking. Probably the biggest, weirdest one was Botox, and I think for cosmetic reasons you take about 6 or 8 shots around the eyes. For migraines you get about 40, and they extend to the base of your skull, and it feels like you're being stung by hornets. And then about 3 days later the Botox kicks in, and suddenly you have no control over half of your face, which I hated because with the vestibular disorder, when I'd start to feel bad, my face becomes less animated. So it was like I already had this semi-disability in my ability to express myself in a nonverbal way, and then half of that has just been taken away. But it helped a little with the headaches, so we did it again a few months later. It was never enough. So yeah, close to 40 medications. I know because when I moved here and started with a new doctor, she wanted a list of everything I tried in the past. So I had my medical record from the neurologist, and I went through every page and I wrote down every medication, and that's when I made the list of the ones that I shouldn't take. Because otherwise it was just sort of this ramshackle. I could tell you levetiracetam was bad. I can't, I don't remember which problems I had with it. So when it was that first 2 or 3 years of it being at its worst, I managed to severely cuss out my supervisor and a coworker because I was overloaded, and they knew I was. They knew I worked near a wooden lobby, big, beautiful arches, terrible echo right to my cubicle, terrible lighting. And I talked to him many times about changing the lighting, changing where I sat, anything to help out. I'd had problems before with having to use the stairs when the elevator went out, and I would get very sick. And they, they were with me from the start of getting sick, so they knew more or less what it was like. But yeah, they put me in a situation where they needed something urgently. I should have never been in that situation. It was ridiculous. There were 30 people in the lobby being very loud. I blurted some stuff out, left the building immediately. I came back when it was all over. I said, hey, I'm really sorry. That's how I react. My fight or flight is not always like pointed in the right direction. I probably don't flee as early as I should. And yeah, I've said some really mean stuff in public because of some noise or some child crying or something. It's not like I say to the mother something terrible about their child, but I'll turn to my husband and I did cuss out my family once too. They were over, I don't remember, for a birthday, my birthday, I have no idea. But it was like just growing and growing, and they knew I was getting worse, and they were still loud, and I cussed them out, and they all just knew, Cindy can't take anymore. Okay, time to go. And my family has been really good about understanding, she hits her breaking point and then she's done, and leave her alone. She'll get better. So it's kind of like a mental illness in that way. And I was very lucky. In my last job was working for essentially a Medicaid mental health insurance company. It's kind of a weird situation. But it was so great to work with all these people with mental illness, because I felt like, okay, I can identify with you on an anxiety level, I can identify with you on a depression level, and I can identify with you in the sense of stigma and ostracism and not knowing how to communicate what you're thinking or feeling in the most effective way. So anyway, I've been lucky that my family and my husband especially they get it. And then I would be remiss not to mention that also at its worst, I had many, many hours to lay in bed, unable to get up, hungry or needing to go to the bathroom or whatever, but just unable to get up and go do simple things. And so I plotted how I would end it. I didn't tell my husband until August. Because I wanted to know that I was in the clear. I needed to know that that wasn't going to be life for the rest of my life. But the problem with the plan is that I had to carry it out when I felt good. And when I felt good, I didn't want to die. Through VITA, we recently started a support group, and I've been trying to figure out, do I want to keep going? Because in some ways it's, there's that element of it that can be depressing, and then there's the element of it where you get to help other people. And I was amazed at the second meeting, someone brought up suicide, and I just kind of, oh my God, you guys, I don't know you guys, I'm not ready to talk about it. And then yet at the same time I felt this guilt, no, we have to talk about it or we don't get anywhere, we don't improve, we don't make progress. So it didn't take me long to decide that I was going to mention it today, but I didn't think it would be this hard. I thought I'd just, slip it in there, and if you heard it, you heard it. And no, why don't I just cry for everyone instead? So now I'll get to the happy chapter of the story. So I moved to Portland a year ago, and when I left my old neurologist, I asked him what advice he had for me in finding a new doctor. And he said to find someone who was a member of the American Headache Society. So I did, read good reviews about her, and had the most amazing first appointment. She listened to all the weird stuff I said, and she said, okay, you could have one of three things, I think, but I'm pretty sure it's not migraine because you just tried 40 medications and they didn't work. Because I tried preventive medications like the beta blockers and the calcium channel blockers. I tried abortive medications like triptans. Every triptan has made me sick. I've taken them, I've taken them orally, I've taken them sublingual, I've taken the shots. When I take the shots, I have about 5 minutes before I have to collapse. And it really does feel like I'm gonna die. There's so much pressure in my chest. It's hard to breathe. And you really do lay there for a few minutes thinking, if you're someone who apparently shouldn't be taking a triptan, other people tell me they don't have this experience at all. But there would be a few minutes where I'd think, okay, maybe this is it. This is the last time. But not this neurologist. She had the novel idea to take a tuning fork and tap it on my ankle. And she said, can you hear that? I was like, yeah. What ear can you hear it in? My right ear. Duh. It's kind of like when the doctor takes, hits your patella and you kick and, you have reflexes. So she did the other side, same thing. And she said, okay, I'm going to refer you to this other doctor. And I think it's vestibular. And I think, it's one of these possible things, but I'm not a vestibular person. So we tried a water pill because it was pretty non-invasive, as opposed to the other medications I'd tried. And let's see, I moved here in February. That was late February. I saw this other doctor. I feel like I should not mention the doctor's names. I feel weird about that. But his specialties are in otology and neurotology, which is a subspecialty of ENT. So he spent extra time studying the neurological problems that can occur in the ear. And so I saw him in March, April 15th last year. He was able to say, why, you have holes in your head. So in May I had my first dehiscence surgery. As he said, it would be one of two things when I first saw him. He said it's either probably this dehiscence or it could be a perilimb fistula, which is the thing I'm now having surgery for. And he said that the reason he thought it was possibly a perilimb fistula when I first saw him, he said, "Have you ever had surgery?" And I said, "Yeah, I had sinus surgery in 2002, and then everything was different. I woke up, my voice was different, and the migraines, and da-da-da-da." He said, "You probably coughed when the breathing tube was in, and that was enough to rupture one of the windows in your ear and cause this fistula." And that was like the turning point for me, because, you know, I'd had headaches and I didn't feel good, and then suddenly, bam, this thing happened with sinus surgery. And then I slowly, mostly got better, and then bam, something happened with the vestibular neuritis, and then I have very, very slowly gotten better, but, you know, I plateaued a few years ago. So, yeah, April 15th, got this diagnosis, had the first surgery. It was like 75% of my symptoms gone. I didn't need to wear sunglasses. I still have the noise-canceling headphones, but I don't need to wear them as much. When I hear loud noise, it's loud in my left ear usually. It's okay in my right. The pulsatile tinnitus stopped. I am so much smarter than I was. And this doctor's office is doing they have a graduate student doing a clinical trial on the cognitive effects of vestibular disorders. So I think I've done 4 rounds of IQ testing at this point. I will say that as a youngster, my IQ tested in the 98th percentile. She hasn't told me where I am now, but I brought her like the proof, you know, this is from my gifted teacher and whatever. So I'm very curious to see, once she's done, the improvements that I've made along the way. And before the first dehiscence surgery and the second, it was like she gave me a puzzle and I would stare at it, and I had no idea how to put the diamonds and the chevrons where they needed to go. It made no sense to me. I would just stare, move, no. It was awful. And by the second one, after that first dehiscence surgery, you know, I felt like a rock star again. I was like, I cannot wait to do the second surgery. This is going to be amazing. So next time I saw the doctor, we set it up, and it didn't go the same at all. When I came out of the second surgery, when I came out of the first surgery, it was like this life-shattering experience, and I think it's because it worked, is what I think. The slightest movement of my head set me off. It was just like a tumbling vertigo, and I couldn't stop. And I couldn't get out of bed for about a day and a half. When I got home, I used those pain pills every chance 4 hours, okay, time to take some more. And it was not that I was in this tremendous pain so much as I was so sick. I needed whatever I could to sleep through as much of that first week as I possibly could. You start off using a walker. I probably used a walker for about a week, moved on to a cane. I probably used a cane for a month after that. And that will help you get a seat on the train, in case you're wondering. Not always, though, not a guarantee. But yeah, about a month after the surgery, I went to the beach with friends, and it was like, I haven't felt that good since I was 15 probably. It was amazing. After the second surgery, it felt a lot more like I had just had my head opened and then closed. There was no significant change in my balance. My balance was pretty good, I thought, for someone who just had a craniotomy. I was up and going with the walker like 4 hours after surgery. Let's do laps. And I went home, and being in a car was very hard. Being a passenger, I was really sensitive again to how much distance my husband was keeping between me and keeping between us and the car in front of us. It took a long time for me to get comfortable with driving again. It was a much longer recovery. And at that point, I thought that I had Bppv, which is another vestibular disorder. I'd had it once following the vestibular neuritis, about 6-8 months after. And Bppv, benign proximal positional vertigo, happens when they're like calcium otoliths, I don't know. They're basically calcium crystals that are in your semicircular canals. And they get out of whack, and when you roll over in bed, suddenly you get dizzy. And that's pretty much what happens for most people who experience it. And I think it's like 10% of people over the age of 50 have this experience or something, but it can happen to people at any age. I think it's the most common of the vestibular disorders. Some people go to a physical therapist. In this case, this summer/fall, when I thought I had it, I didn't want to bother my surgeon, so I went to a vestibular therapist. I said, I think I have Bppv, can we do the Dix-Hallpike maneuver and see? And I went for 3 rounds, did some additional vestibular therapy, was not getting any better. Did try some steroids, that helped for maybe a week past the time that I took them, so I had about a 3 week window where I felt really good. And then I was back down the crapper again. So still, disclaimer, I do still feel like a good 75% of my symptoms are gone because of that first dehiscence surgery. It could be that I was asymptomatic on the left side. It's not as big of a hole. It's just a thin bone. He did say that when he filled the right side, there were a lot of holes. When he filled the left, he said there weren't that many. So it is possible I was asymptomatic, or it's possible that it helped some. Either way, I think it would have continued to get worse on my left, and I probably needed to have the surgery at some point. So I'm still glad I did it. So where that's kind of left me is that when I first saw the doctor a year ago, and he said, well, it's superior canal dehiscence or it's perilimb fistula. Well, now we know it's not dehiscence. I even went back and did an MRI to make sure that there's still titanium there, and there's still bone chips that he put in. So everything is well sealed on both sides. So we started pursuing this route of perilimb fistula, which happens to have basically the same symptoms. Neither diagnosis is more severe than the other. It's just that you experience the symptoms to a different degree. So like for me, if I believe I have a fistula, that's what we're operating on. For me, the fistula is the lesser thing. For me, the dehiscence on the right side was what caused a lot of symptoms or made me very sensitive to those triggers. I have a friend who I met through the support group. I like to call him a unicorn. I think he prefers that we stick with rare bird, that we are rare birds. And he has had a dehiscence and a fistula repair, and still has some problems. But he's figured out a way to work with it. But yeah, when I heard that someone else had a superior canal dehiscence, I was like, oh my God, we're gonna be friends for life. You're the only one who knows what I'm going through. But I know for him, the fistula reopened after he had surgery, and that has been the thing that causes him the most problem. The dehiscence wasn't as big of a problem for him. Yeah.
So you talk about your husband. What has helped to keep things going? I mean, it's you going through an awful lot, but it's very hard to be on the outside and keep that empathy going, and especially when you're the one picking up the dog poop and all of that. So what do you think has worked?
At one time, when I was really bad, I had gone to a fibromyalgia support group, and the people whined. I didn't like it, and I was like, I'm never going back to another support group. But at that time, I was encouraging him to go to a caregiver's support group. So that's kind of hypocritical of me. But at the same time, I knew that he was taking on so much. Like, as sick as I was, okay, there's nothing I can do about it, and I just have to shut down at that point. I can only worry about it so much. But as sick as I was, that was more stuff for him to deal with. So he knew that I was aware of how much he was doing, and like he still, when I take a nap, he still comes in, after an hour, and he's like, "You need more sleep?" Okay, and he knows if I grumble or whatever, then just leave me alone. But I think there are still a lot of good times. Like, Yeah, we can go anywhere. We can go do anything as long as it isn't the grocery store or like shopping. But we can pretty much go anywhere and have a great time. I can go to a concert and have a great time. If it's outdoors, I'll lay down. If it's indoors, I'll wear earplugs and stand by a wall. So even the things that I'm not supposed to be able to do, I'm making myself do that, because every time I go to a concert, I'm so glad I went. I'm like, man, I hate that I got home at midnight, but that was so much fun. I know I'm going to be wiped out for days. But it really helps that I married my best friend. We just never get tired of each other. So
did he go to the support group?
No. No. And my in-laws have been a mixed bag. I've had some in-laws who are very supportive, and I've had some who weren't, and talked bad about me behind my back and said Cindy's faking it, et cetera, until I finally got the fibromyalgia diagnosis. And then they could go, oh, I've heard of that, gosh golly gee, and then it was like a real thing. Even though, 5 years ago, people would have gone, fibromyalgia, not a real thing. But so I kind of got some street cred there, but they still didn't understand. I can't go to the party and stay at the party. Maybe I'll go to the birthday party and I'll be there for 20 minutes and I'll leave, or I'll spend the whole time outside, but I can't be inside with all the people, and especially the screaming kids. So he gets that. He sees that more than anyone else. Like, I think aside from people who've had a vestibular disorder, I think he understands it better than anyone who hasn't experienced one, just because he so pays attention. And when, if we go to a store, especially the grocery store, he sees my face go blank before I even realize that I'm starting to get really bad. He'll notice that I physically change, and he'll tell me, you should go ahead and go to the car. Or if we do manage to make it all the way to the checkout lane, then the beeping is too much, and I tell him, okay, you get to take over from here. So
I think he's a really special person, because not all family members react that way. There are a lot of marriages that have ended because the other person just couldn't get what their partner was going through.
Yeah, and I don't think I could have made it through it without him. Not just because of who he is. Had he been someone else, had he not been so understanding and so smart and fun and all the things I love about him, it just wouldn't have been worth it to try and keep that up. So.
I want to encourage other questions. Think of
yes,
this as
please.
an opportunity to practice for your concept analysis, asking questions. But I want to ask one more question and then I'll shut up. So these are all students who are in the process of becoming nurses. So keeping that in mind, what would be something that you would want them to know about someone like you?
Number one, I'm not a malingerer. The nurses I've worked with have been really great, and I think that's something that's like innate in nurses, is their ability to care for other people. I guess the biggest thing I want you to take from this is, when a patient reports a weird symptom or something strange that's happened to them, don't slough it off. Don't think it's nothing, because sometimes the most obscure things are what get you to the diagnosis. And I think it would have been hard to have diagnosed me between 2002 and 2008, but 2008 to now, I'm disappointed in the medical community. And I don't think that's the fault of nurses, certainly, but I do think it's the fault of doctors who are too myopic. So yeah, I guess my advice, my wish would be to think broadly and encourage the people that you work with to do the same thing.
Any questions?
Anything. Ask me about my dogs, no.
Can they sense when you're doing better or worse?
I don't think they care. I think they have my husband so trained to like, hey, I need to go outside. And, he's on it, so they go to him and tell him. But it's going to be really hard during my bed rest because I've got a recliner and I have flat surfaces on either side, so I can't access the dogs. So unless they decide to jump up, I am going to really miss that. But I can only lift 5 pounds during the first 3 weeks, so I can't even move one of my cats off my lap. I'll be stuck. Yeah.
How have you managed your finances with changing work and changing locations and all your surgeries?
What sucks is that my husband was a math major. I do the finances. I'm the personal finance person. And probably the absolute hardest thing for the first 2 or 3 years after getting sick is that I'm still the one writing the checks, but I was the one writing the checks. And it made me so sick to look at the statement, actually remember what that number was, be able to write it here, to spell everything correctly. I mean, it would take me 30 minutes sometimes to pay one bill. And so, more so than the extraordinary thousands and thousands and thousands of dollars we've spent, it's that just paying the stupid bills was so hard. And I just don't trust him to do it. And he knows that, and he's cool with that. He doesn't want to, it's just, that's one of my responsibilities. So thankfully I have been able to maintain that. But being a financially minded person, and the first year was probably a really hard hit in 2008 because I wasn't prepared for it, but then I started socking away as much money as I could in flex spending, anything pre-tax, so like every year I look at what has the lowest deductible relative to my premium, blah, 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 so that I can have, because I know I'm gonna max it out. Every year, I'm gonna max it out. So, the reason I'm having surgery on a Wednesday is because my husband started on his own insurance April 1st, and now my out-of-pocket max is $5,000 instead of $10,000. So I waited 3 months to have surgery to save myself $5,000. Because I'm like, well, I've been living like this for years. What's a few more months when I can save $5,000? So yeah, I'm lucky that we're both college educated. I got my master's when I was halfway through my master's when I got sick. And again, stupid, stubborn, I don't know, I toughed it out. We were in finance class. I could not even read a sentence. And I had a team, a group, and I told them, I'm sorry guys, I know that I should be the one leading this, but I can't. And so they carried my weight through that class and, slowly saw me get better over the next few months. I think I missed class once from being sick. It was the dumbest thing I've done. It was ridiculous. Sitting in class for 4 hours, feeling that awful, not understanding what was happening, or having to give a presentation. It was really ridiculous. But, you get the master's degree, you make more money, you can afford the surgeries a little easier, so whatever. But, yeah.
So after the fistula surgery, is it kind of expected that if this is the problem, you'll have a complete recovery then, or do they think that there's still going to be vestibular symptoms?
The people I've met who have had fistula surgery, I'm thinking of 2 people in particular, and I think in both their cases they reopened. One blames it on a CPAP machine, which makes sense to me, makes sense to him, makes sense to his doctors, and he's not prepared to do surgery again. The other person I know had fistulas when she was much younger, and I don't think she considers it bad enough that she wants to do surgery again. So I don't really know what to expect. I keep thinking I'm going to be 100%. That's my goal. I'm signing up to take a Tai Chi class through Parks and Rec over the summer because I tried it a couple years ago and I'd fall down. I bought a bike a few years ago. Can't ride the bike. I thought this was gonna help me get better, but no, my husband had to ride behind me and tell me if I needed to stop. For cars, I couldn't check cross traffic or anything. It was awful. And I did fall a few times. But yeah, so I totally got off topic there. What was your original question?
Well, just whether all the symptoms.
Oh, 100%. Yeah, so I don't know, but I know that my goals are to be able to bike. I want to ride a tilt-a-whirl or roller coaster again and enjoy it. I want to be able to go camping because it's so physically exhausting right now. Everything is so exhausting. So, you know, if the dehiscence surgery, if the first one took care of 75%, I'd be pretty happy if half of the remaining symptoms were taken care of, but I'm really hoping it's more than that. Yeah, because sometimes it just drives me batty. Like, one of those great invisible diseases.
I will say that for most vestibular patients, there is no cure. You learn to live a new normal.
Right.
Cindy has. You just learn to adapt and cope and accept that this is what your life is going to be like. And
Yeah.
because it's invisible to everybody else, I think that's one of the most frustrating things, because you look normal, and to other people, they don't get why you can't do what everyone else can do.
It's hard to explain to your coworkers, I'm going to nap at my desk now, and you're going to be okay with that. That's, you know, sometimes I have to do that. And when I found out that a year ago that the two things I likely had both had surgical interventions, I was elated. And then when I actually got a diagnosis, I cried out of joy for the first time in, you know, years. I mean, how often do you cry out of joy? But I couldn't believe it. I couldn't believe this could be fixed. I would even be happy with something where I can find a good maintenance drug. Right now normally I take naproxen, which, if you're not familiar with it, it's just like Aleve, but 10% higher dosage for the headache. And then I take diazepam 1 to 2 times a day most days. Today I've already taken it twice. I can't take NSAIDs right now because I'm having surgery in 2 days. So my headache is really bad, but my vestibular problems aren't as bad because I've taken the diazepam twice. So that's another thing. You got to convince a doctor, no, really, you should be giving me this much diazepam. I'm not abusing it. So
it seems like a big piece is the fact that you have something that is, from the medical community's perspective, incredibly obscure, so they either don't know about it,
right,
or they mislabel you, or they make assumptions.
There's so many reasons you can be dizzy.
right,
And so what the medical community normally goes to are the ones, the diagnoses.
the common
like,
thing,s
You know, do you have a stroke? No?
Right.
Okay, take this medication and go home.
right,
Most vestibular patients, almost every vestibular patient I have ever heard from has said that the first, especially general practitioners and emergency room physicians, which is what happens with a lot with them because they fall and they end up in the emergency room, they just want to make sure you're not going to die, and then they want to give you a drug and send you on your way. And what we'd really like to do is get physicians to at least recognize this could be a vestibular disorder. Let's get you to a specialist. And not even all ENTs can recognize a vestibular disorder. It's very difficult to diagnose. Cindy's story is very typical. Most people report it takes them 5 to 7 years, and they see at least 10 doctors before they receive a diagnosis. And in the meantime, their lives are like Cindy, struggling with work, with relationships, and with pain.
I thought about applying for disability so many times, but I didn't even know what to put as my diagnosis. You know, like,
most people are denied at least the first time, and they have to seek legal help in order to get disability for vestibular disorder.
I did, after getting the superior canal dehiscence diagnosis, I did write to my old neurologist and my old audiologist and let them know. I'm very disappointed that the neurologist never replied I ended up sending 2 letters eventually to both because the audiologist did reply, and he said, "Oh my God, I've seen SCD once, I think, ever." So, you know, of course he wasn't looking for that. Of course he was looking for the common things. And how many times had I read about it and thought, I don't have a rare disease, I don't have a rare disorder, you know? And another thing, I talked about my body being sort of on high alert all the time. For years, when I'd go do blood tests, my white blood cell count was always just past normal. So if, you know, normal ended at 11.4, I was like at 11.8 or something. I was always just, then and every doctor would say, oh, you must have had a sinus infection, or you must have had a cold or something. No, I didn't. My C-reactive protein levels were always elevated. My SED rate was always elevated. My blood pressure rate was always elevated, just out of the normal range. And after I had that first dehiscence surgery, everything fell in line. 2 months later, when I had blood tests done, everything was normal for the first time in 5 years. And then it slowly started to creep back up again. So I think that first surgery brought this incredible amount of stability, and I had this new homeostasis. And now slowly the pain, the headaches, the nausea, all of this crept back in. And so I hope in 2 weeks maybe I'm back on the road to feeling good. I hope. I should be well read by the end of my bed rest.
Can you listen to books?
I'm going to listen to audiobooks at first and then transition to books, because at least with audiobooks I can miss a chunk and it's like, okay, whatever, go on. But reading is much harder for me. In fact, for 3 or 4 years I just listened to audiobooks because I couldn't read, which is funny because I work in communications and, you know, yeah.
Well, we really appreciate your sharing with us.
Yeah.
You know, I appreciate the fact that we do bring in folks that are outside of the things that we usually talk about, because we talk about the top 10 kinds of things. Just to, again, make that point that sometimes you got to think a little bit outside of the box about what might be going on with somebody.
Yeah, I was a girl with a headache, and it's not a neurologist who needed to treat me, so be open-minded. That's my wise wisdom.
Thank you so much.
Thank you, guys. Feel free to ask me more questions.